A new study reveals that diabetes is far more widespread than anyone thought. Nearly 350 million adults around the world have the disease. That's double the rate of 3 decades ago. So why is it on the rise, and can it be avoided? This is Inside Story. Hello there, welcome to the programme. Good to have you with us. I'm Shuli Ghosh. Researchers from Imperial College London and Harvard University analysed data from over 2.5 million adults across the world. They found the number of people with type 2 diabetes, which is linked to obesity and lifestyle, is no longer limited to rich countries. It's now a global problem and fast becoming the largest cost for many healthcare systems. Of the top 12 countries with the largest incidence of the disease, 6 are Gulf states. Nazanin Sadri takes a look at Qatar, which has one of the highest rates of diabetes in the world.
Growing up in a country that's economically booming and in a region that's fast changing, these Qatari children are reaping some of the benefits of living in a globalised world. But the lifestyle change is having a direct effect on the health of the people who live here. At least 30% of Qatari children are overweight. The figure for adults reaches 70%. Obesity is one reason why this small Gulf nation ranks so high in the world average for diabetes. An estimated 16% of the population is diabetic. The global average is 6%. Medical experts here describe diabetes as a silent killer, which makes public awareness and education crucial. Making patients, particularly children, aware that small steps can be taken to deal with the disease effectively is vital. This is an insulin pump. It works by helping a diabetic calculate the amount of insulin needed based on food intake and blood sugar levels. The required amount is then transmitted via a small tube and a needle that's placed on the stomach. It makes controlling a diabetic's diet much easier. The other initiatives to make Qataris healthy include promoting compulsory sports classes in schools and encouraging more active lifestyles. With the number of people with diabetes growing around the world, it's a disease that no country can afford to ignore. Nazanin Sadri for Inside Story.
Well, let me introduce today's guests. In Southampton, in the UK, Dr. Michael Hall. He's the former chairman and current vice president of Diabetes UK. That's the UK's largest diabetes charity. In Rome, Lorenzo Piemonte from the International Diabetes Federation. Mr. Piemonte is also a diabetes patient. And here in Doha, Dr. Khalid bin Jabor Al Thani, the former Under-Secretary of Qatar's Ministry of Health. Gentlemen, welcome to the programme. Dr. Khalid, let me start with you. We've heard that 16% of the Qatari population is diabetic, and we know that 70% of the adults are overweight. So diabetes clearly a big problem here in Qatar.
Well, definitely it is, and I'm not sure if it's 16%. I probably think it's way above that figure. In the past few years, we've seen a lot of diabetic cases, and a lot of people are trying not to register as diabetics. You know, they shy away and they think that it's related to whether it is a social issue that they don't want to show it up, or probably to other illnesses, and they don't want really people to know about it. But definitely it's not 16%. I think it's way above 16%.
So clearly it hasn't come as a surprise to you, this new study showing that diabetes is a much greater problem than we had previously thought.
No, not at all. I'm not surprised with the study. What the study has done is to have reaffirmed what we were saying years and years back, that diabetes is on the rise. It's rampant in the society. We are not doing anything. There is nothing as a national program to reduce the onset of diabetes, although, as the report have said, that there are countries who are trying to control it. There are very few countries that have been successful around the world in controlling diabetes and in sustaining the onset of diabetes. Yes, we have a lot of reasons. If you want to talk about the aging population, if you want to talk about the high rate of births in this country and the growth, if you want to talk about the habits and the dormancy of people are not being active, if you are talking about the lack of a sport and the type of food that they eat, it all adds up. But definitely it's a major issue.
Michael, is that the case? It's people's lifestyles around the world that's leading to this increase in diabetes, a richer diet, lack of physical activity?
Certainly in the greater part of Europe, that is the problem. Lifestyle, and of course that includes dietary problems and lack of exercise. The other problem, of course, is that many people, we're an older society, we're an ageing society, and diabetes is commoner as we get older. So we have the two things. You can't deal with getting older, but you can deal with trying to keep fit by eating healthily and by taking exercise.
Are there other factors, for example, genetics, population growth?
Well, there's clearly genetics. Ethnicity is an important part of the general problem. You mentioned the Gulf states as having a very high prevalence of diabetes, which of course is true. And if you look further around the world, the Pacific Islands, some of them have an even higher rate of diabetes, type 2 diabetes, than in the Gulf states. It is something which we need to address urgently. We need to look at ways of trying to prevent it, and we know that there are ways of preventing the development of type 2 diabetes, like taking more exercise and eating more healthily.
OK, well, just for the benefit of our viewers, let's just have a look at diabetes and the different types that can occur. Diabetes is caused when your body fails to produce enough insulin or can't use the insulin it does produce. That's a problem because insulin is the hormone that makes sure blood sugar levels are properly regulated. Now, people with type 1 diabetes are completely unable to produce insulin. The cause isn't known. It can't be prevented. Patients have to receive daily doses of insulin. Now, people with type 2 diabetes can produce insulin, but their cells don't respond to it. 90% of diabetes sufferers have type 2. Now, in either case, diabetes can cause serious complications like kidney failure, blindness, heart disease and reduced blood flow, leading to amputation. Let me bring in Lorenzo. Lorenzo, I know that you have type 1 diabetes, but in any case, it's obviously a huge thing in your life. It's something that you have to monitor, you have to control.
Well, definitely. I mean, I've been living with diabetes for close to 20 years now, and it's really a part of my daily routine. I can't live without insulin, so I have to think every day, 4 or 5 times a day, I have to inject myself with insulin. I have to monitor my blood glucose regularly to make sure that it doesn't get too high, doesn't get too low. So really, all my lifestyle depends on managing and controlling my diabetes. Yeah,
it clearly impacts on your life. What about the other health risks? Do you have a greater risk of heart disease, of having a stroke?
Yeah, that's definitely kidney disease, as you mentioned, eye disease as well. Yeah, those are things that I always have to think about, and that's why it's important to monitor my blood glucose and make sure that I follow my treatment regimen correctly, or else I do risk serious consequences later in life.
Now, obviously, diabetes 2 is the type of diabetes that we're talking about mainly as regards this study, and actually most people would have diabetes 2, and it's something that seems to be diagnosed in middle age. Does it affect women more, men more? Is there any clear definition?
Well, until I guess not too long ago, type 2 diabetes was primarily diagnosed in people over 40, but in recent years we've seen a big rise in younger people, even children being diagnosed with type 2. So that's why it's a very serious health risk globally, because it's not just a disease of the elderly anymore.
Yeah. Khalid, one of the problems with the figures that we had, they were saying the study says 347 million people worldwide have diabetes, but of course that's not taking into account the children and the young people who haven't got to middle age and may well develop it because they are overweight and they're not active enough.
I do agree with that. I think the study, as I said earlier, it was reaffirming what was going on. But if I talk specifically about the Gulf states and Qatar in particular, we are not counting the children. And you see a lot of children who are obese. They say 30%. I think it's more than 30%. And that's a big issue that we need to address. If you are talking about kids in their teens, years and they are obese, they are not playing sports, they are not active at all, how are you going to encourage them when they become 20s and 30s? I think that's an issue that we really have to look at.
And whose responsibility is that? Isn't it your responsibility?
I think it's everybody's responsibility. We should start and focus on education. We should start at a very young age, and we have to actually have the families participate in that. You cannot educate the little children in the school about something and then they go home and find a completely different practice. I think you have to come up with a program that will cover everybody and have incentives. Unfortunately, because health is covered for everybody here free of charge in most of the Gulf, there are no gatekeepers that will make sure that if you don't lose weight, if you don't improve on your quality of life, your insurance premium, for example, will go up, and that will hurt your pocket. This has been effective in some countries, but I think we have to find ways of triggering people to do so. Otherwise, what you are doing, only teaching people at schools, and you are not pushing them to practice and play sports as well and not be competitive, it's not going to work.
That's a really interesting point that Khalid's making there. Michael, this is going to become, if the trend continues, this is going to become a huge drain on governments' health budgets.
Well, of course. It's going to have a really serious economic effect on the well-being of countries, not just on their health services, but the number of people that are sick because of diabetes, who won't be able to work, or partly will have to finish work early. Indeed, for the individual and their families, it's a really serious economic problem. And one of the important things is, you mentioned the complications of diabetes, like stroke, like heart attack, like going blind, like kidney failure. These all actually have another effect. They shorten people's lives. So people with diabetes have a lesser life expectancy than those who don't have it. So that's why it's really important for the individuals as well as for the state and for the economy of the countries. In fact, for the economy of the world, I think.
Well, let's take a look at where diabetes occurs more often. What's clear is that diabetes is more prevalent in some parts of the world than others. China and India have 138 million people living with diabetes. The United States and Russia have another 36 million. The spike in levels has been the most dramatic in Pacific Island nations, with a third of all women and a quarter of all men suffering diabetes in the Marshall Islands. Levels are lowest in the Netherlands, Austria and France, while levels have remained relatively unchanged in sub-Saharan Africa, Central Latin America and Singapore. Michael, the levels lowest in Netherlands, Austria, France, do we know why?
Well, there's some suggestion that they had a burst of increased numbers with diabetes in the last 10 or 15 years. And it's beginning to level out, though there is still increasing numbers of people with diabetes in the Western European countries. So that's one reason. The other is that many of them now have what we call national diabetes plans. They have them in place for handling not just the health side of managing diabetes, but also looking at important things like the environment, like the quality of the urban life we live in, trying to get exercise and healthy eating as a real big priority for public health. And these countries have been addressing that, and maybe it's because of that it's slowed the rate of increase in the countries.
Lorenzo, do you agree with that? Do you think some countries are being more proactive and having enough of an education programme, or could they do more?
Well, yes, if you look at most industrialized countries, Europe in particular, I live in Belgium, and I can see the healthcare system at work. I can see the benefits I get, that I manage to control my diabetes effectively. I get all my medication. I don't have any issues with that. So, but the problem is many countries just don't have the resources to really put money into diabetes plans and into funding what's needed to curb the epidemic, and also to ensure that people have appropriate access to care and medication.
Khalid, you were saying that, of course, all healthcare is as I know well, provided for here in Qatar. So What can you do to make people take more responsibility for their own health?
Just before I answer that, I would just want to add up, definitely the countries in Europe that have really reduced the rates, we can say it's still increasing at a decreasing rate in the sense that the numbers are not as high as before. But going back to what we have here in Qatar, I just want to add also one more point, is that we spend millions of dollars every year in sending people to be treated for heart diseases, people to be treated for renal failure, people to be treated for ophthalmological and eye diseases as well, and all different neuropathies that you can get with that. And everybody is not looking specifically at the main cause of why we are spending these hundreds of millions of dollars in treating people abroad to get them to...
Why not? Why aren't they looking at the causes?
Well, you know, everybody wants to go at the higher end. Everybody wants to have a fancy hospital and build health palaces rather than, you know, saving lives. We should focus on a comprehensive plan, and I mean it, a comprehensive plan. We should start at a very young age, and you have to include families. If you go to the women's hospital and find out how many ladies are with gestational diabetes, these are on the track to get diabetes as they go on. They are at their 20s and at their early 30s, and they have gestational diabetes, which is pregnancy diabetes. These ladies definitely will develop diabetes as they go on, you know, in their late 30s and 40s. This is the issue. This is the problem. I don't have a problem with people aging and getting diabetes at the age of 60 or 70. Well, that's something that we can understand. But you are talking about a very young population.
You're worried about future generations.
Of course.
Of course. Why isn't the Ministry of Health taking action on this? Because it's losing millions of dollars a year, as you've pointed out.
Yeah, but nobody's addressing the issue itself. It's been celebrated when you have the Diabetes International Day, and just little activities from time to time, but there is nothing serious, nothing that scares people off. You know, you only get to have problems when you go to see your ophthalmologist, and he tells you, do you have diabetes? And you say, yes, I have diabetes, and suddenly you have cataract. You know, people are not... How many people... I would like you, with your program, to go on the streets and stop 100 people and ask them, what are the complications of diabetes? You'll find probably 10% of the people might know. The rest don't.
Do you agree with that, Michael?
That's very important. Well, yes, and I'd like to just say, you know, people think, for example, that heart attack is a serious thing, which it is, of course. But when you say, well, what about diabetes, they treat that as being of less consequence. But in fact, many of the people who have heart attacks, probably the largest number, already have diabetes, which is setting them up to have a heart attack. So this is where we have to sell the idea to the population as well as to our governments that treating the real cause of these problems, like eye disease, like heart disease, like kidney disease, make sure they don't have diabetes, and you will reduce the problems in those areas.
Lorenzo, before you were diagnosed, I mean, presumably you were diagnosed as having diabetes at quite a young age because you're type 1, but the people that you come across, are they aware of what the symptoms are? Are they aware of what the causes are?
I would say it's still, as Michael said, it's a work in progress in getting the general public to know what diabetes is and what the consequences are. Before I started working with IDF, and which was a few years after I was diagnosed, I myself, who was living with the disease, didn't know a lot about it. I tried to go on with my daily life, but without really trying to get more knowledge about the things that I could be at risk of. But in my daily work with IDF, for example, on the World Diabetes Day campaign, we come across the issue of just the general public just doesn't think diabetes is serious. They may have a family member with diabetes or know someone with diabetes, but still they know very little about it.
Do you keep up with the latest research? There was obviously this study this week from the Newcastle University, which discovered that type 2 diabetes, if you put patients on a really extreme diet of 600 calories a day, they could reverse the diabetes in a week. What do you make of that study?
Well, of course, that's... sorry.
Sorry, go ahead, Michael. What were you going to say?
Well, we've always known that severely restricting your carbohydrate intake reduces the effects of having not enough insulin. And certainly with people with diabetes, with type 2 diabetes, if you could really restrict their diets, then you probably will begin to reverse the numbers who have diabetes. But actually, living on a 600-calorie diet is a really extremely difficult thing to do.
Yeah, I'm not sure I could do it.
How practical that is, I don't know. Well, there you are.
Khalid, I'm not sure many Qataris who enjoy their food would like to live on 600 calories a day.
Not at all, and I think it's very difficult for people to live on 600 calories a day. It's really difficult. It needs willpower, and very rarely you find people who are willing to do so.
But perhaps there should be more research into preventing diabetes?
I agree. Research and preventing. Yeah.
Sorry,
and
Michael.
I'm sure that you know that, I'm sure that you know that the World Conference, the International Diabetes Federation World Conference on Diabetes, is going to be in Dubai this year in December, and there will be a lot of discussion about research into the prevention of diabetes there. Should be attracting probably 15,000 people or more. So it's going to be a very important meeting particularly for all those with interest in diabetes in the Gulf states.
Yeah, I mean, there are a lot of interesting factors about diabetes. I was reading that certain groups like Asians and blacks have higher susceptibility. Apparently they don't have to be as obese as people of European descent in order to get diabetes. So there's obviously a lot we don't understand about it.
There's a lot more we need to know, you're right.
Khalid, do you think there's enough research being done into diabetes?
No, not really. I'm talking about this part of the world. We are in our infancy in fighting diabetes, and we look at it from a completely different view. That's the issue that we really need to change the view of people. People have to believe that it is a killer. It's not something that you can just live with it like that. It's not easy to control yourself when you are diabetic, and it's not easy when you are way obese and trying to get back on track. People really have to understand the danger of diabetes. It is really a silent killer.
If nothing is done, Khalid, and this trend continues, what do you think this means for future generations?
Well, I think we'll have a lot of chronic diseases, and we should be ready for high-tech, sophisticated sort of hospitals to cater for them.
Lorenzo, as someone who lives with the disease, I mean, do you see a huge impact on future generations if we don't get control of this now?
Well, the numbers continue to rise. We're already over 300 million, predicting close to 500 million within the next 10, 15 years. So it really is a leading threat for human health and development. And if nothing is done, it's just going to get worse. And we hope in September we have a very key meeting at the United Nations in New York, UN high-level summit on non-communicable diseases, where diabetes will be one of the diseases showcased, and we hope to get some concrete outcomes to make headway in the fight against the epidemic.
Yeah, that's very encouraging to hear. Michael, I wonder how much of a priority governments around the world make this, because of course a lot of countries where this is a problem are also dealing with political instability or AIDS or other issues, malaria, things like that they have to get a grip on. Do you think that it is seen as a priority by other states?
I think it's beginning to be seen as a priority by states, and particularly this move on chronic diseases, which are called non-communicable diseases, and the meeting in the United Nations is a major world attempt to bring diabetes, heart disease and other such problems to the attention of the world's governments. And action now is needed if we are to help prevent a real crisis for future generations.
Gentlemen, it's a fascinating discussion. Thank you very much indeed for joining us on the programme today. Thank you to all our guests, Dr. Michael Hall, Lorenzo Piemonte and Dr. Khalid bin Jabor Al Thani.
Thank you.
And thank you at home for joining us on this programme. If you do have any comments, then do email us at insidestory@aljazeera.net. But for the moment, from me, Shuli Ghosh, bye-bye for now.